Hi, my name is Rhiannon King. I'm taking Sociology 101 Honors with Dr. Tauha, and I am going to be presenting something very close to my heart as a preschool teacher and as a survivor of COVID. My presentation is my presentation is best practices changes in childcare policies during the COVID-19 pandemic. Um, so let's get started. So the first thing I want to talk about is the number of COVID-19 cases that are related to childcare, particularly childcare centers. There are other sorts of childcare. For example, there's nannies and there's childcare facilities that are in home. But I'm going to specifically be focusing on centers such as preschools and such as the one that I work at. Right now, there's a little less than 10,000 childcare centers that are open. A lot have actually closed during the pandemic, partially due to lack of enrollment and partially due to lack of funds to keep things going. And there's been over 3,000 reported cases. I was one of those cases. And the bulk of these cases are among the staff. There could be several different reasons for this. It could be that half of these staff cases are happening at the preschool. It could, and they're catching it from the children and from the parents that they're interacting with, and that the other half are occurring outside as they're going about their day at the grocery store or doing other errands where they come into contact with the general public. That's certainly possible. But what it could also be is that there are a lot of unreported cases from the children that are occurring, and this can happen because in young children in particular, COVID cases tend to be asymptomatic. So the children might not have any symptoms, might not get tested, and their case will not get reported. So it could be that the number of cases we're seeing for children is actually much higher. So one of the things that's very important in our job is the teacher-to-student ratios. These are very heavily monitored in licensing all of the time, not just during COVID. And so we've seen a lot of changes for mostly older kids. When it comes to children under the age of 2, that ratio is always 1 teacher for every 4 infants. There's something called a toddler option. Not all schools have this. It's an optional license for children that are 18 months to 36 months. So children that aren't 2 yet all the way up to when they turn 3. And even though schools might have children those ages enrolled, they might not have a toddler option. But if you do have a toddler option, then the ratio for that age group would be 1 teacher for every 6 children. And if you do not have that child care option at your school, then the ratio for children aged 24 months all the way up to 6 years old is 1 teacher for every 12 students. And student enrollment, there are upper limits depending on different ages, but it's largely done by how large the actual classroom is, because usually the classroom is not big enough to actually hit that upper limit of students that are allowed to be in a classroom at a time. But when it comes to my personal experience, I've been in infant rooms that had 20 children every day. I've been in preschool rooms that had 30 children every day, and had even more enrolled, but those children that were enrolled didn't come every day. But during COVID, that has changed drastically. Initially, we were only allowed to have up to 10 children in each of our classrooms, even at the higher ratios. And now we're still up to our original ratios of 1 to 12 and 1 to 4 and 1 to 6, but now we still have an upper limit of 16. What the CDC is calling this, and what the Department of Social Services is calling this, is called a cohort, is that our groups, we're supposed to stick together, we're supposed to stay together, and we're not allowed to have more than 16 students at a time in any cohort. So what this has done actually is this has changed the way we open our schools in the morning and the way we close our centers in the evenings. Before, parents would come in and out of the school, they would get to come into the classroom, they would get to talk to the teacher and make that very important connection between the family and the teacher, to be able to talk about your day, understand what's going on with your child, what the class is doing, what they're learning, things like that. And on top of that, there would be particular opening classrooms. For example, for the infant program, we have an infant that is under one classroom and then an infant room that is over one. And both of the children from both of those classes would be dropped off into the infant under one classroom. And as more teachers came in and as more students came in, those groups would then separate into their original classrooms. And as the day closed, they would combine back again into a closing classroom. And the same thing would happen on the preschool side, except because the preschool age group is larger, there would be more students. And so there would be multiple times when they split up into different groups, sometimes on one of the schoolyards or the playgrounds, and sometimes inside, depending on the weather, depending on the season. And that's how it would go. That was the normal practice. It's pretty common, and it's been completely turned on its head. Now the best practice is to have an opening and a closing teacher in each classroom, which necessitates having more staff. And it does change a lot of things, like being able to do lunch breaks, but those are not really relevant to the presentation here. So now what happens is combining different classrooms only happens outside. It doesn't happen in any individual classroom. And when it does happen, it's always the same two classes that are coming together, and it's never more than two classes. And as on top of that, as it does happen, we're still supposed to try to separate the different groups so they're not interacting as much. And that's very important. But also when it comes to pick up and drop off, parents are not allowed inside anymore, which has been it's a big thing, because California does consider it a parent's right to be able to come in anytime they want normally. But these days now, we scan the child, take their temperature before they come in, make sure they don't have a fever, and someone, usually one of the front staff, not usually the teacher from that child's class, gets to come on out. So that does change, because those parents aren't able to talk to the teacher, they're not able to connect with us, they're not able to see the different kids. So that does change things from an emotional perspective as well. So I've talked a little bit about using the playgrounds, using the yards. So this is one of the several common spaces. We also, at my school that I work at, we have a multi-purpose room that has things like a rock climbing wall. And in the past, we've used that specifically to have a big body play space during when it's a rainy day, or you can't take the kids outside because it's too hot, things like that. And so the way things would usually work before is that how many kids were allowed on the yard depended on how large the yard was, and multiple classes could use the yard at the same time before, and generally throughout the day classes would rotate and have different play times and outside times, and it would just be based off of the size and the limitations if they wanted to split kids up or keep them together. And now we have to sanitize between uses. When we're done using it, we spray everything down with bleach well, we're using bleach, but others might use Lysol or other CDC approved disinfectants. And again, trying to keep different classes separate is encouraged. At my school, we have several different yards, and so there's a schedule of which class is using which yards which days. And that keeps us separate, but it still allows children to make use of the different facilities that are on each yard. So now we come to classroom equipment. There's been some important changes here. So in the past, the equipment was pretty much only limited on what is it reasonable for your children to use, what is safe for your children to use, because you can't give toys to a 1-year-old that you would give to a 5-year-old because of choking hazards, of how appropriate it is for them to be able to have those skills to actually use it. Best practice has been to spray everything down at the end of the day, make sure it gets a quick clean, and of course if anything got dirty, it should be washed. If it went in anyone's mouth, it needs to be washed and sanitized. And now during COVID, one of the things that's changed is that it's recommended that we don't use any stuffed animals, any soft toys, and no dress-up clothes or cloth things. And the reason is because in between each use, we are expected to wash and sanitize those because they hold on to the virus in a way that is harder to sanitize than something with a hard surface. For example, with a stuffed animal, if the virus and the germs were to go inside where the stuffing is, well, you can't sanitize that. You can clean it in a washing machine, but you can't actually sanitize it by spraying it over with bleach. You would have to submerge it in a solution and then dry it. So rugs and carpets, for the same reason, are discouraged, but they're still allowed, which is very important because a lot of classrooms in different schools have tile. And so when kids fall, it can become a risk factor, and that is why those things are allowed. Staff are also encouraged to sanitize more often than once a day. This might be during nap time when everything can air dry and the kids aren't playing with things, or it might be right before everyone goes outside for the same reason, so that it can air dry, because that's the best practice, is to let sanitizing agents air dry instead of wiping it down to dry it. And that brings us right into sanitization. The process itself has not changed. Best practice is to clean things with soap first to get off the dirt, and then to sanitize with bleach to kill the germs. Lysol and other cleaning products are also used alongside bleach. The CDC has a list of recommended and approved things. The CDC also specifically recommends Lysol wipes for staff to wipe things down before using them. However, that's not always available, and it can be expensive. Staff are still required to wear gloves when handling food, when changing diapers, touching trash, things that make your hands dirty. And of course, even though we use gloves, we are still supposed to wash our hands afterwards. It's just that second layer of cleanliness that helps keep us from passing these things on, and it helps contain the virus even when there's been an exposure like that. We're also supposed to wear masks, of course, and we do. I am so used to wearing them every single day. I wear mine all the time, but we're only required to wear them whenever we're within 6 feet of a child. And obviously, if you're working in the infant room and you're feeding children, you're holding children, you're rocking them to sleep, that's going to be pretty much all of the time. But even if you're with the older kids in the preschool room, you might have to tie someone's shoes. You might have to give them a hug when they fell down, or you might be teaching them something and then showing them something. And really, it just amounts to pretty much you're surrounded, you're within 6 feet of children all of the time. And while the CDC's definition of a mask does not include face shields, I have seen staff members wearing face shields and not a mask covering. So the face masks in the face shields instead of the mask is allowed. When it comes to the sick policies have changed. It used to be that children had to be symptom-free for 24 hours before they could come back, and that meant without medicine. If your child was sent home with a fever and you gave them Tylenol in the morning, they are not allowed back until the next day. These symptoms meant they had to have a fever that was over 100 degrees Fahrenheit, 3 diarrheas in a day, vomiting, or lice. And as for the staff, we were adults. We could choose to call out if we needed to call out, and we could come back when we felt better. But now things have changed. Like I've said before, when children and staff come in, we take our temperatures. And nowadays, children can be sent home for coughing because that is one of the main symptoms of COVID that we see. So if children are having a coughing fit and it's happening all day, then they're going to be sent home. Sometimes water might go down and you might start coughing, but we see these kids, we're watching out, we know what the difference is between, oh, they caught something and went down the wrong way versus they're having a coughing fit all day. All right, so when children test positive, the parents usually alert the center themselves. The center is going to talk to everybody that came into contact with that child. The health department is going to contact the center, but that happens through the hospital because the hospital that, or the agency that did the testing is going to be the one reporting to the health department, and the health department is then going to call the center. The center has the freedom to make their own policy on what happens then. They can choose to close that room only. They can choose to ask that parent to quarantine, and they can choose to close the entire school. Those are left up to the individual. For the most part, it is not an automatic closure. The health department might choose to close schools, especially if there are more than one case, or depending on how many cases there are. When staff tests positive, it's very much the same situation. I wanted to also clarify that the contagious period is considered to be 48 hours before the first symptoms, and that whether or not someone is exposed depends on how close they were to the person who tested positive and how long they were there. It was something that was very surprising to me when I tested positive and I asked these questions of the health department agent that I talked to. Okay, these are my sources. Most of my sources were from California Department of Social Services, from the Center of Disease Control, the Department of Health, and I got several different memos from to be my sources, and I pulled up the things that I actually encounter at work every day to pull up these sources and back up the things that I already knew. So that is the entirety of my presentation. Thank you very much for listening. I hoped you learned something that you thought was important. Have a nice day.